Yo, once again, it is Dr. J and
Dr. K.
And welcome to yet another review of In Treatment of the sensational season 4. All right, starting Aduba. Once again, this is Dr. J from Cypher, also known as the extra large professor. And remember, whenever we're doing these reviews of HBO, we hope that it encourages all of our viewers to wipe away the stigma that associated with mental health. As always, this is a review, so when we're giving this is not our professional saying of what you should do. It's just our review of the entertainment show In Treatment HBO. So let's go. Let's do this. So I have to be real with y'all. I'm not really feeling Eladio at all. I just don't feel this guy at all.
Extra large.
Here's the thing. Okay, so we're in week 4, and once again with Eladio, I just feel that as a viewer, we keep getting different stories about him and his relationship with the DeMarcos. Okay, if you quickly just recap, when we go into week 1, we get a description of Eladio as a caretaker for adolescent Jeremy.
Then they say it was an adolescent
who basically, based on the way that they described him, he described him as an adolescent that he was being a caretaker for. Then week 2, we get, Jeremy is actually an adult, and I probably wouldn't even be friends with him. And so that's week 2. Then week 3, then we get, I met Miss DeMarco as a waiter. In day 1, she takes me in, pays for therapy, give me this rich, plush place to live in. But I realize I'm a non-essential worker and making $12 an hour. That's week 3. Now week 4, he states that he loves Jeremy. And we don't, and the way it's described it's like a romance, but he said basically he puts people in 2 categories: people he would have blank with, or people he would not have blank with. And not to mention, in all of those reviews sprinkled in is this whole boundary pushing maternal transference that's going on. So let me just talk to the actual therapist of the group. Let's talk about, why is this character constantly changing his story when it comes to the relationship with the DeMarcos? What is going on with this guy?
Probably it's whatever you're getting is whatever he's feeling in theory. It's a complex relationship. I think you want it to be 2 meat in a bottle. And therapy is like that. Often therapy is quite messy, even with the most difficult situations. You feel like, it still has some points to it that make sense in a puzzle. Some of them are messy, and I think Eladio's just one of them. I love Eladio. I think he's complex. He brings a lot, even if there's stuff that we don't know. Because my thing is, even if he is making it up, even if he is lying, whatever it is, it serves a purpose. It's there for a reason, and that's why he's in therapy. So,
and I just, for me, I get that therapy is messy. I get that he's a complex person, but I would say his storyline is incredibly frustrating for me, because being a professor of English, it just feels so discursive. It's all over the place. And I'm not getting a clear picture as to what it is that's really impacted him. Unlike Colin, unlike Layla, unlike Brooke, whose storylines where you kind of get an idea. I still don't quite know what Eladio issue is, and he's frustrating me. That's
why you're not a therapist. But I think for therapists, it's par for the course. I think that's what, if this was reversed and they showed a teacher teaching a student and they couldn't get the English paper together, I'd be just as frustrated. You said it, just do it. So for me, that's a part of what we do. It's going to be complex, going to be complicated. And I mean, it's only 3 sessions?
We're in week 4.
That's why. So you're trying to discourage people from therapy. This is why you bring all your mess. Just like the church says, bring all your stuff here. It's a hospital. Bring all your mess to therapy because therapists know what to do with it. You will not have Dr. J who's like, get it together, come in with your answers quick. That's what therapy's about, and it's okay, and it's messy. And unlike Brooke, I don't drink to hold people's pain, but most good therapists know what to do with that stuff, help weave it together. And so maybe we'll have an answer next week.
Okay, and speaking of Brooke and that, because I definitely want to move on from Eladio. Once again, we have her really pushing the issue of maternal transference. Mm-hmm. She kind of pointed out that he had maternal transference where Eladio was looking at her to be a mother figure. Mm-hmm. And then it was presented on the show, it seemed like she was trying to get him to find a way to find those resources for himself and not necessarily look to her as the actual mother figure. Mm-hmm. But we know that she has her own maternal issues as well, giving up her son. Mm-hmm. He pointed out that their relationship pushes the boundaries, or he recognizes that their relationship is beyond just therapy. Mm-hmm. But Brooke does something that I really want to talk to you about as a therapist. Is she pushes Eladio to do this reparenting, and she seemed fixated on presenting herself as the parent, and it really kind of pushes. Because Eladio was talking about a situation where we're taking that maybe he may have been abused in some way. Mm-hmm. He was writing, "I'm sorry," and for masturbating, mm-hmm. and he was trying to present that to his mom, and it didn't go well. But she was trying to play the role of his mom, and it just kind of ended the session. Mm-hmm. What can you tell the viewers? What was this whole idea of reparenting, or what does that actually mean here?
Mm-hmm. Now, I'm not as familiar with that, but my understanding is at least part of it is sort of given a corrective experience. And so even in therapy in general, even without using that term, we try to create a space that's safe and different from what a lot of people have been through. So giving you permission to feel what you feel, showing the empathy that you didn't get in the past, allowing you that space to express yourself. So there are elements of that are appropriate, but then for somebody who blurs the lines already, and I think reparenting has been controversial. I think it depends on in what vein it's coming in, because I think I read somewhere where some of it may be people living with you forever, living with you for a long period of time. So you're really going back through these motions of what the family situation would have been like, even down to physical touch and things that were really kind of unethical for most people to do. And so I think it blurs lines. There's a way to be there alongside, as opposed to I'm with this in you, with you in this with you. So I don't know. Again, it's not real therapy. I think it's bringing in some elements of the therapeutic process that are controversial, and he's just a controversial character, and she is too, as a therapist and with him. And so for some reason, her stuff is really playing out with him. But if he has what I think he has, the nature of what he has draws on your stuff anyway. And you have to be careful to not enter into that space with them, which I think is easy for her to do because her boundaries are so lax right now. So, yeah.
All right. Well, going into my boy, Mr. Colin. I want to say this week 4, we see a major breakthrough in Colin. He is beginning to really understand, and I really feel like beginning to make some changes. He still has issues with control, because he comes in and tries to sit in Dr. Brooks' seat again. And she was like, no, we're not doing that this time, you know? So he still has this push-pull type thing, and he likes, as he says, to mix it up. He recalls his relationship with his wife. It's making him really understand that what he thinks is in his mind is not necessarily what people are thinking. And so he has this whole tendency of, I feel like these people are hate me, and he actually writes out a script in his mind about what other people think about him. And Brooke was saying that you really don't have any control over what people think, and you have to trust what they think based on what they tell you. And they're having this beautiful session, and then all of a sudden he breaks out into, well, what if I wrote a letter to that person that, what if I really did send a letter, threatening letter to the lady who dissed me on Twitter? And, you know, and he gets back into this fight with Brooke. And she was like, why do you feel that need? And I think he's beginning to make some headway. But he does something at the end that I wanted to really specifically ask you about. He was asking, like, with his last therapy session, which he needs, ladies and gentlemen, for his probation, if he could bring his ex-wife. We don't know if she shows up yet, but she grants him permission. Why do you think she grants him permission in such a vulnerable state?
For us, I guess, you know, you let the client lead, and, you know, their rights in the sense of, you know, for at least for me, I believe everybody has what they need inside of them. And so maybe there's a need that he has in this safe place to do it. Part of me is afraid that he'll use that space to badger the wife. If he's got this get back at you spirit, you know, like, well, she told me to bring you. It's like, well, no, I didn't. So it could be part of her lapse in judgment. Like, he's got for probation, let it be about him. But, you know, he's been so evasive. Maybe she's like, okay, he's opening up, or she may think he probably won't do it anyway. Or Colin's the type that would do what he wants to do. So I don't know. He's a complicated guy too. But you just never know with him. I'd be really afraid of what he actually might say or do.
I see I see him turning this corner, but he definitely leaves a lot of work. I don't know personally if he's ready for probation, or if he is, it really needs to be some sort of supervised probation with therapy assigned to it, because he can very quickly go back. I feel like he is one of those guys that if he has any form of power, it will corrupt him. You know, so, you know, it's going to be interesting to see how Colin goes in the future.
And that might be a part of her allowing it. Number one, is he going to go through with it? But it could be the undoing of himself. You know, well, you want this, so we'll allow it. And then he can really, because he's never going to show who he is in this artificial setting with her. But if the wife comes and it's an ex-wife, she's got her own perspective. And then that's when maybe a flare-up will happen and be like, nah, you ain't ready. And so it may be to his detriment, but he's asking for it. So